Honourable Member for Provencher.
Good morning, Madam Speaker, and thank you for this opportunity to speak to this bill. Mitch Bushaman was a lifelong resident of Ile-des-Chênes, Manitoba, in my riding of Provencher. His family and friends described him as a quiet, gentle, and generous individual, always ready to lend a helping hand, yet never needing recognition. Well, I'm going to give him a little recognition this morning. Mitch was a member of the Ile-des-Chênes Knights of Columbus Council and an advocate for Diabetes Manitoba. He was passionate about supporting those living with diabetes, and he actively lobbied the government on behalf of those with the disease. Mitch just wasn't an advocate. He lived with type 1 diabetes for 40 years. Then, early last year, Mitch was able to receive a kidney and pancreas transplant, effectively closing the chapter on decades of managing his diabetes. Sadly, he passed away this past September, but not without leaving his mark. In 2016, I was invited to be one of several guest speakers at a fundraiser Mitch organized called Let's Get Pumped, with proceeds going to the Canadian Diabetes Association. It had all the trappings: a luncheon, live music, speakers, and a silent auction, and a 50-50 draw. He was quoted in the Niverville Citizen at the time saying he wanted to do this event not only because of his own experience, but for all diabetics in the province. Beyond this event, my office heard from Mitch from time to time, always making sure diabetes was top of mind for decision makers. Though I know many, including his wife Kathy, are missing him dearly, his memory lives on. It's a pleasure to have this opportunity to speak to Bill C-237 this morning, the National Framework for Diabetes Act. I would like to think that Mitch would be pleased to see this conversation taking place today in this House of Parliament. I want to thank my colleague, the member for Brampton South, for bringing forward this legislation. Her advocacy has been generating general awareness about diabetes for several years now. As Diabetes Canada so succinctly puts it, diabetes is a disease in which your body either can't produce insulin or can't properly use the insulin that it produces. Some 11 million Canadians are living with diabetes or pre-diabetes. If we consider an average 24-hour period, about 20 Canadians will die as a result of diabetes complications. 620 will receive a diabetes diagnosis. 14 of them will have their lower limbs amputated. These numbers represent real people, family members, friends, neighbors, whose lives have been lost or dramatically changed as a result of this disease. The National Framework for Diabetes Act seeks to develop a national framework designed to support improved access to diabetes prevention and treatment to ensure better health. It looks to include measures to explain what diabetes and prediabetes are, to identify training and education needs of healthcare professionals related to the prevention and treatment of diabetes, to promote research and knowledge sharing, and to improve data collection. Bill C-237 would also require the Minister of Health to hold at least one conference with relevant stakeholders to develop this framework. And within 1 year from when this act comes into force, the Minister must report to the House on this framework. This is an important accountability mechanism that ensures the Minister will do the work necessary to build this framework. Although we must also be wary that this has no guarantee that the Minister would meaningfully address issues that face diabetics here in Canada. Canadians should have stable and reasonable access to the healthcare and treatments that they need. By working with stakeholders like Diabetes Canada, we can take concrete steps forward to develop a plan for the prevention and management of diabetes in Canada through a national strategy. When the Health Committee studied this subject in 2019, it made important recommendations which bear mentioning. First one was that the Government of Canada, in partnership with provinces and territories and in collaboration with stakeholders such as Diabetes Canada, plan and implement an approach to the prevention and management of diabetics in Canada through a national diabetes strategy. And secondly, that as a part of a national diabetes strategy, the Government of Canada, in partnership with the province and territories and in collaboration with stakeholders such as Diabetes Canada, explore options for establishing a national diabetes registry for people living with both type 1 and type 2 diabetes, explore options to reduce diabetes-related stigma, and finally, explore options to improve public health awareness and education on diabetes, particularly through community programming, including public awareness of the relationship between nutrition and diabetes. The bill serves to answer the call on these 2019 recommendations, but it is worth noting that programming already exists to address common risk factors of diabetes within the integrated strategy on healthy living and chronic disease. In going forward with this bill, there must be clarity about how the national strategy would tie in with existing programming. A number of previous governments had taken important steps forward on diabetes as well. In 1999, the federal government created the Canadian Diabetes Strategy to further the prevention, early detection, and self-management of diabetes and its complications and national surveillance. They committed $115 million over 5 years for that strategy. In 2005, the Canadian Diabetes Strategy became part of the Integral Strategy on Healthy Living and Chronic Disease. Funding for the Canadian Diabetes Strategy was renewed in 2005, and $18 million yearly was introduced for the Public Health Agency of Canada's diabetes programming. Funding for diabetes research is also dispersed through the Canadian Institute for Health Research. In 2010 and 11, under the previous Conservative government, the Canadian Institutes for Health Research funded approximately $44 million in diabetes research. As I reviewed this history, I was struck by the gap between the previous Conservative government's funding and where we find ourselves today. When the Health Committee recommendations I highlighted earlier were laid out, the committee had a Liberal majority. They were supported by Canadian Conservative members of the Health Committee, and it was understood that the government needed to act. Unfortunately, we just haven't seen much action from this current Liberal government. As a government during these recent years, they could have introduced a government bill, but no such bill was introduced, not when they had a majority and not now in current Parliament. Had they chosen to introduce a government bill, Parliament could have already had work underway to develop this framework. Bill C-237 is important, but Canadians with diabetes also know it's late. It's also troubling that this Liberal government's most memorable connection to diabetes is when they oversaw a Canada Revenue Agency crackdown on access to the disability tax credit, a non-refundable tax credit that helps persons with diabetes reduce the amount of income tax they may have to pay. In 2017, the CRA began restricting access to this disability tax credit that affected hundreds of Canadians living with diabetes and other rare diseases. This happened because officials changed the interpretation of the rules around life-sustaining therapy and associated requirements for those diseases. Our Conservative opposition sounded the alarm and stood with organizations demanding that Canadians continue to receive the benefits they ought to have access to. Given this history, I think there would be value in including an amendment to ensure that the Canada Revenue Agency is administering the disability tax credit fairly, and that the disability tax credit is designed to help as many persons with diabetes as possible. I think this is something that would give the committee can look at when this bill is referred. I think we can all see how this would give greater certainty to those folks who rely on the disability tax credit. But now it's my duty as an opposition member to constructively critique the proposal. I've highlighted where I think it could be bettered, but I don't want to dwell there. I appreciate that the member for Brampton South is stepping up. In the absence of action from her government, she is using the opportunity, thank you, that she has been afforded through the private members bill lottery to move the dial forward on this issue. I commend her for that. And at a time when so much attention has been dedicated to COVID-19, it can be easy to forget that the daily challenges faced by individuals with diabetes have continued without receiving much media attention and without widely publicized diagnosis. The final word is this: there is merit to committed and coordinated federal leadership to tackle diabetes in Canada. We have an opportunity to move the ball forward in a strategy that can help support those living with diabetes and help prevent millions of potential cases like this. Like I said before, we're talking about real people. This can better the lives of millions of Canadians today and in the future. I encourage all members of this House to move this bill forward to committee so that we can take a long overdue step. Thank you, Madam Speaker.